A 34-year-old man came to see me, slim, athletic, non-drinker, no symptoms at all. He had come in for a routine blood test. His liver enzymes came back slightly elevated. I sent him for an ultrasound, grade 2 fatty liver. He was completely stunned. He said, I don't drink, I'm not overweight, I go to the gym. How can I possibly have a fatty liver? And that is exactly the question I want to answer today, because this man is not unusual. He represents millions of people who are walking around right now with a liver that is silently drowning in fat and no idea it's happening. Here is a number that should shock you. Studies show that 1 in 3 adults in India have non-alcoholic fatty liver disease. Not 1 in 10, not in 1 in 20, 1 in 3. And the vast majority of them feel completely fine. This is the defining feature of the fatty liver disease. It has no symptoms in the early stages. No pain, no jaundice, no fatigue that would make you suspicious. Your liver is being damaged in silence and your body is not sending you any warning at all. By the time people find out, most have grade 1. Many are already grade 2 or 3. Significant damage has already occurred. Now let me explain what is actually happening, because this is the part that changes how you think about your diet forever. Your liver is one of your most hardworking organs. It filters your blood, processes everything you eat, and makes substances your body depends on. A small amount of fat in the liver is completely normal. The problem begins when the liver starts manufacturing far more fat than it should. Fat that has nowhere to go. So it starts accumulating inside the liver cells themselves. And here is what surprises almost everyone. This fat is not being created from the fat you eat. It is being created from sugar. When you consume sugar, the glucose in white rice, bread, refined flour, or the fructose in a packaged foods, cold drinks, what most people consider healthy, fruit juices, your liver receives it and converts it into fat. Fructose is the real problem here. Unlike glucose, which your muscles, your heart, your brain can all use for energy, fructose can only be processed by the liver. Every gram of fructose you eat goes directly to the liver. When the liver is overwhelmed by the volume, it converts that fructose into triglycerides, which is nothing but fat, and stores it. Human studies have shown that overfeeding people, fructose increased their liver fat by 27% in just weeks. Their body weight barely changed, but their liver fat increased by far more than a quarter. The glass of fresh fruit juice you drink every morning thinking it is healthy, it delivers a concentrated fructose load directly to your liver. No fiber to slow it down. This is not the same as eating whole fruit. This is one of the most underappreciated causes of fatty liver in people who believe they're eating well. Now here is why, as a stroke and lifestyle prevention specialist, this concerns me deeply. Fatty liver does not stay in the liver. As fat accumulates, it triggers chronic inflammation that travels through your bloodstream, damages artery walls, accelerates the plaque buildup that causes heart attack and strokes. Left untreated, it progresses from fat accumulation to liver inflammation and then to permanent scarring, which we medically call cirrhosis, where the only option may be a transplant. But long before that, this disease silently rising your heart attack risk every single day. Fatty liver is your body telling you that your metabolism is under serious stress. But here is the good news. It is genuinely good news. Fatty liver is completely reversible if caught early, and the reversal does not require medications. A 2019 clinical study placed the patients with fatty liver on a very low sugar diet, less than 3% of calories from added sugar. And within weeks, average liver fat dropped from 25% to 17%. The liver was healing itself simply because the sugar load had been removed. A 2021 study tested both intermittent fasting and a low carbohydrate diet. Both approaches reduced fatty liver by over 50%. No drugs, no surgery. Just a deliberate change in what went into the body. The mechanism is simple. Fatty liver is caused by excess sugar, driving fat overproduction in the liver. Remove that excess sugar load, the liver begins to clear the fat on its own. What does this mean for you right now? Stop treating fruit juice as a healthy food. Eat whole fruit instead. The fiber changes everything about how your body processes the sugar. Significantly cut refined carbohydrates, white rice, white bread, maida, packaged snacks, sugary drinks. You do not need to eliminate them entirely, but you need to be deliberate and add a simple fasting window to your day. Finish your dinner by 8 p.m. Don't eat until late morning. The evidence on this for liver fat reduction is strong, and if a blood test has ever shown your ALT or AST is slightly elevated, or if an ultrasound has mentioned fatty changes, Please do not ignore that report. This is your liver asking for help. The 34-year-old I told you about, we changed his diet, cut out the fruit juice. He was drinking twice a day, reduced the refined carbs, added a 14-hour fasting window. 8 months later, grade 1 fatty liver, improving, no medications. Please share this video with someone who eats healthy but has never had their liver checked, with someone who drinks fruit juice every morning, with anyone who has been told their liver enzymes are slightly off and assumed it was nothing. 1 in 3 Indians has this condition and most of them don't know, and most of them can reverse it if they start now. I am Dr. Harsha, a stroke, lifestyle and prevention expert. To understand how a damaged liver directly increases your risk of stroke, watch this next.